our first guest knows what it's like to be on both ends of a doctor's appointment. When she was pregnant, she told her doctors that she had a family history of preeclampsia, but they brushed her off and told her she would be fine. That was until she developed severe preeclampsia 38 weeks into her pregnancy. Now, she was rushed to the ER to give birth to her son, but it was during her hospital stay that she truly experienced bias in healthcare. This experience pushed her to advocate for Black maternal health care for underserved communities as a women's health nurse practitioner. Please welcome to the show, Dr. Shawana Moore.
Yes! Thanks so much for having me.
Dr. Moore, could you just paint us a picture about what you experienced? I know it's hard, but during your hospital stay right after giving birth.
Absolutely. So I had a very traumatic hospital experience post my birthing experience. I didn't feel as though the healthcare providers were listening to myself or my husband's concerns. I can remember being wheeled up into my actual hospital room, and the bells and whistles started to go off. I broke out into a huge sweat. My husband looked really, really scared and paranoid, and nobody showed up for about at least 5 to 10 minutes. And the nurse rushed in. And she said, "Did anybody come in? Did anybody come in? Your blood pressure is dropping." And my husband shook his head no. And she put me in an appropriate position to raise my blood pressure. But that was just one incident. And again, I just felt like I was dismissed. I wasn't cared for in an attentive way, nor was I given a quality care until I had a student who actually worked on that unit and had to tell her colleagues that I was a professor and I was a nurse practitioner.
Right.
And it wasn't until then I felt like I was heard.
Well,
wow.
Speaking of being heard, I wanted to ask you, what did this teach you about being a patient? Because you know this story from both sides now.
So it taught me the importance of patients being and feeling empowered to utilize their voice within the healthcare setting. And it showed me the importance of patients understanding that they are a critical part of the healthcare team, and their voice is just as valuable as the healthcare provider. And from a provider perspective, it taught me to always listen to my patients, to always validate what they're saying and to act upon that.
Dr. Moore, how did that experience motivate you to do the advocacy work you do now for Black maternal health care and health care for underserved communities?
So health equity has always been a passion of mine and a core to what I do on a day-to-day basis. So as a director of the Doctor of Nursing Practice program at Emory University, I help prepare the next generation of advanced practice providers that'll go out there and care for diverse communities. So I ensure things like health equity, social determinants of health, social justice is implemented within the curriculum. As the president of the National Association of Nurse Practitioners of Women's Health, throughout our organization, we ensure that equity and justice is threaded through all that we provide to our members, including educational opportunities.
You know, Dr. Moore, I really appreciate you being here. I really want to get your thoughts on why so many women, or especially women of color, experience medical gaslighting.
So I think this all boils down to the isms, both sexism as well as racism, and it has a really historical context. And again, these systems have been structurally put in place over time. And I always say the beauty of those structures that have been put in place, they can be dismantled. Yes. But again, those isms really play a critical role in gaslighting, medical gaslighting, specifically for women and women of color. We know based on the data that women have a longer road to diagnosis for certain health conditions when compared to male counterparts, specifically thinking of cancer. When we look at our Black and brown communities of individuals, we know that medical diagnosis and treatment is delayed because of medical gaslighting. Again, I put that directly on those isms, both sexism as well as racism.
Well said. Dr. Moore, thank you so much for sharing your story with us and educating us more about medicine in America. DBL Nation, you can learn more about Dr. Moore's work at mpwh.org. Thank you again, Dr. Moore.
Thank you for what you do. Thank you.